Alright class, we are going to go ahead and get started with today's session. Now I have Sandra, our volunteer patient, in for an in-depth scalp assessment today. And today's scalp assessment will be focusing on lice and other forms of infestation. Okay, so Sandra is here as our model, and we will be performing a very detailed examination of the scalp and hair itself, having a look at the follicle of the hair as well as the shaft, strength and integrity, and then of course for any signs of either eggs or hatched infestation. Okay, also having a look at the brow and the lashes, as sometimes forms of mites can protrude down to lower areas of the face. So what we are going to do to start, of course, because this is an examination that would potentially pertain to infestation, ordinarily you would have your hair tied back and potentially even wear some form of hair covering, whether it be a hair net or a lice protection. Obviously, this is a simulation for research purposes, so I am going to go ahead and put on a pair of gloves, and we will assume that I have properly cleansed my hands prior to donning my gloves. As with all of our demonstrations, I would like everyone to be taking notes as I am speaking. You are welcome to stop and ask any questions along the way. Otherwise, I will be narrating the examination as I run through everything. And you are more than welcome to write your questions down and ask me after class. Okay? All right. So Sandra, is it okay if we go ahead and proceed with the demonstration today?
Yes.
Okay. So I'm going to be performing a scalp assessment. I will kind of be focusing my attention from the eyes up, mainly of the scalp and hair. Of course, if there are any areas of tenderness or discomfort, you are more than welcome to let me know. So, assuming that Sandra is a patient in real clinical practice, we are going to say that she has come in with symptoms of itching, maybe some slight flaking that she's found on her clothes, and she's just not quite sure if it's due to some form of dermatitis or any other scalp issue, or if she's had exposure to an active infestation. So, as I stated, obviously, in real clinical practice, your hair would be tied up and protected. Okay, I think that goes without saying. So we are going to go ahead and get started with the exam. And what I would like to do with any formal examination is to start with kind of a visual inspection. So just an overall look at the area itself. So I'm going to go ahead and have a look here with my pen light. Sandra, this light is very bright. I won't be shining it directly in your eyes, but at some points I will be having a look at your eyelashes. So you're welcome to close your eyes if it becomes uncomfortable. So I'm just going to start here, right at the temporal region, having a look at the hair that surrounds the hairline. Oftentimes we tend to see the most flaking or kind of fragmented areas here. So just performing a visual inspection, manipulating the hair slightly out of the way so that I can see the skin that lies beneath. Just very gently moving the hair. We don't want to agitate too much yet. So far, not seeing anything here. Side as well. If we look at the hair as a whole, Sandra's hair is nice and clean, very soft, no buildup of grease or excess oil production, well groomed, nice and brushed. We will have a look at the strength and integrity of the overall hair, but for now, just kind of having a brief look. So now I'm going to have a look at your eyebrows, Sandra. So bringing the light slightly closer to your eye, I'm going to shine my light at the top of the brow bone and just kind of look around. Just looking for anything here. So far, nothing notable. Always want to check bilaterally for any differences there. So looking at this side and don't see anything here either. And then as we come down and look at the lashes, class, you want to be very careful not to accidentally poke your patient in the eye. So we're keeping our hand here. I like to use my pinky as a brace very gently against the side of the face. And then you can use your middle finger and thumb as kind of a placeholder for your penlight, gently rotating at the wrist to better visualize all angles of the lash. I don't like to hold my penlight like this suspended in the air because there's a higher chance that you'll drop it onto the patient's face. Coming over on the other side, same thing. Just visualizing the eyelashes, nice and full. Sandra's lashes are very long. They do have a curl to them. No signs of sparsity. I'm not noticing any areas of emptiness. I don't see any shed hairs on the face. Sometimes that can be a good indication if you see eyelashes kind of down on the cheek area. So far that's not notable here. All right. So as far as our initial visual inspection, I'm not seeing anything that appears particularly concerning just right off the bat. Okay, so now we are going to do a bit more of an in-depth assessment. So I have a secondary lighted tool here, and this is actually an otoscope that would typically be used for ear, nose, and throat examinations. I, however, am going to be using this as a visualizer to be able to come closer to Sandra's brows and lashes. So coming in here, just having a closer look at the brow. Just going to be pulling down gently and then up. Having a look at the eyebrow hairs individually, looking for any, again, signs of sparsity or abnormal discoloration of the skin, any signs of irritation or folliculitis, and of course, looking for any signs of infestation. So there's not quite as much hair of the brows, so I don't tend to see lice here. It is possible, but more so can see some form of mice or mite droppings, excuse me. So not seeing any of that today. And then as I come really close to Sandra's eye, I'm just going to have a look here at the eyelash. So Sandra, I'm just going to turn your head here slightly so the class can better visualize this portion of the exam. So as I'm looking at Sandra's lash, I'm going to very gently, I like to use my middle finger or ring fingers. They tend to apply less pressure. So you're going to very gently pull down on the skin below the eye, and then you can use your thumb to pull up on the eyelid, and that better exposes the lash line. So then we come closer to Sandra's face and we visualize directly along the lash line and looking for any signs of infestation, whether it be small darkened spots or any sort of discharge. That's not notable here. So same thing on the other side. I'm going to start at the eyebrow and just coming in and having a look at the brow line. I'm going to gently pull up and manipulate slightly and down. And I'm going to gently pull down at the lower lash line, visualizing the follicle, and then gently pull up simultaneously to better expose any potential areas of concern. Very good. All right. Now, I personally like to complete the exam of the brows and the lashes at the start of the appointment. I just find that it's a bit easier on the patient so that we're not continuously switching back and forth from scalp to brows to lashes. I like to do our visual assessment, focus on the brows and lashes, and then move in to the completed scalp exam. Okay, that's just a personal preference. I find that the exam flows better as a whole. So we are going to then go back in for our brow assessment. Now I have here a Lice comb, and the difference here, just to show you from a regular comb, now we will be using both. So I have the Lice comb and the regular comb, and as you can see, the Lice comb has very tightly packed bristles versus the regular comb is a lot more loose, and they grab the hair significantly differently. So you do have to be careful with the Lice comb not to get it stuck or tangled in your patient's hair. Okay, so to start with, I'm going to go in with our Lice comb, and I'm just going to very delicately manipulate the brow hair, looking for any signs of dislodgement. You want to be very careful here not to pull the hair accidentally or make your patient uncomfortable. So we're just very gently manipulating the hair in the opposite direction. Now I will say for these examinations, I do prefer my patient to come in with no makeup on so that we're not worried about ruining any eye makeup that they may have applied. So Sandra did a very good job today of coming in with her beautiful natural skin. So we are going to do the same thing on the other side. We're just manipulating upwards, brushing the hair in the opposite direction of hair growth. And because the bristles of this comb are so tightly packed, we can pull it all the way through the shaft of the hair, the length of the hair, and then just brushing everything back into place. So we are going to go in and have a look at the lashes very, very carefully, okay? Very carefully. So we are just gently manipulating the lashes here. Now, if your patient has shorter or more sparse lashes, you might want to avoid this step or just be more careful overall. You can also use a spoolie in place of a Lice comb for the lash area only. If your patient has any artificial eyelash enhancements, you definitely want to ask prior to performing this portion of the examination, because we do not want to pull out any lash extensions. So as you can see, Sandra's lashes are so long that I can't actually just comb through them. Just very gently checking for any dislodgement here or any abnormalities. So far that does look okay. Now we will be obtaining samples of her brow, lash, and hair. So what we are going to do, firstly, is I have just a regular cotton tip applicator. I'm going to go in with the first looks just like this. Everyone should be fairly familiar. And what I'm going to do is use a specimen cup, very standard. I'm going to use one for each area. So we'll use one for the brows, one for the lashes, one for the hair sampling. So what we're going to do is go in with a cotton tip, very gently swipe at the inner brow, at the mid brow, and at the tail of the brow. I like to do 3 on each side just to ensure adequate sampling. Then you're going to place your Q-tip in the cup and snap off the excess. Now we're going to take a secondary cotton tipped applicator. Same thing, this time we're sampling at the lash line, okay? So for the lash line, I like to be very, very careful. We are going to very delicately swipe directly along the skin. Remember not to apply too much pressure here, as the skin around the eyes is very delicate. So we're just gently swiping along the lash line, making sure to graze the lashes themselves. We're going to do the same thing on the other side, just very gently swiping along the lash line, grazing the eyelashes as we go. I like to go in both directions to ensure an adequate sample. Then we're going to go underneath the lashes themselves and gentle manipulation here, obtaining an adequate sample of the follicle line. Very gentle. Do not poke your patient in the eye. Okay. Once you've obtained your sample, you place it in the specimen cup and break off the excess. Now, I'm going to set this down for just a second. So I'm going to grab another set of cotton tip applicators. And firstly, we are going to obtain a sample of the hair itself. So I'm going to use this metal tool to separate a small section of Sandra's hair. I try to obtain my sample from somewhere along the crown, somewhere in the middle of the hair. Doesn't have to be precise. So now that we have a slightly parted line, we are going to obtain a sample of one singular hair strand directly along the parted line. Try to ensure that you are getting a sample that has the follicle attached. That's very important for the lab to be able to test appropriately. So just going to find one single hair. Once you have the hair, we're going to hold on to it very carefully and place it in the specimen cup. Sometimes sticks to our tweezers, that's okay. So I've got the hair in the cup. Now we're going to go in with our cotton tip applicator just as we did before. And obtain a sample in a similar area. So I'm going to start here at the forehead, sliding the Q-tip directly along the scalp, back and forth a few times. And place it in the cup. So that completes a 4-step sample. We would then close the cup, seal this off. Make sure you label your cups always with a patient sticker. Place it in a biohazard bag, and then we would send that off to the lab. Scalp samples can be sent in the tube system. That's fine. You don't have to walk them down. Okay? So we can then proceed with the more detailed portion of the scalp exam now that we've obtained our sample. So what I'm going to do now is go ahead and go in and complete our assessment. So I'm going to start with some palpations here, Sandra. You're going to feel me feeling around with my hands. So I like to start with a flat-handed motion. Okay, so we're just using the palms of our hands and the tips of our fingers to kind of gently palpate flatly along the scalp. This helps feel for any nodules, any lumps or bumps of the cranium that would suggest any signs of inflammation. So So gentle swiping motions. We're not pulling our patient's hair. We're simply feeling for any abnormalities of the cranium itself, which so far is not notable for Sandra. No signs of swelling, no areas that are distended or signs of edematous skin. And then we're just going to manipulate slightly along the hairline. Now I'm going to start looking within the scalp itself. Okay, so very important that we don't just focus on the hairline. You also want to look in the scalp. Look for any areas of concern. Now Sandra has very lightly colored hair, so if there were any signs of infestation, live lice would be very easy to see because her hair is so light. Eggs might be slightly more difficult, so if your patient has darker hair, I might suggest wearing a headlamp, but for Sandra's hair and for the purposes of the demonstration, I can see just fine. So I do see a small flake here, so I'm just going to go in with my light. I'm going to attempt to remove that. I will hold my light, go in with my tweezers. And I do see some flaking here. It appears to just be dislodgement of dead skin cells. It's not consistent with the shape of a lice egg. So just normal variation in skin texture there, okay? So to make it easier to section through the scalp, I'm gonna once again go in with my metal tool and just do some scalp sectioning. I like to work in a bit of a grid pattern, kind of 1-inch sections at a time so that you don't miss anything. So just separating parallel to the nose. I'm just going back in sections just like this, about 1 inch apart. Just looking for any differences here, any signs of abnormal redness or irritation. Then I'm going to go in horizontal sections. Again, looking for any signs of redness, irritation, flaking, infestation. So make sure you are looking thoroughly. Ordinarily, you would have an adjustable headrest so that you could then manipulate your patient's head even further, visualize near the nape of the neck, the back of the scalp. Make sure that there are no areas that are being missed. Okay. Does anyone have any questions for me so far? Okay, all right. I'm going to go back in with my Penlight and have a look at the hair itself. So now we're looking at overall strength and integrity of the hair shaft. So I'm going to start with about a 1-inch section here. You don't want to grab too much, but just enough so you can get a good visualization. So holding the hair tautly but not pulling. I'm going to start at the hairline just like this. And we are going to follow that down the length of the hair, visualizing as you go. Good. And once you get to the end, I like to establish grip and then visualize the underside of the hair here. So can everyone see that okay? So we're following along, looking at the overall integrity of the hair for any signs of breakage. So you can see here, Sandra does have just a little bit of breakage, but nothing particularly concerning, nothing that indicates a weakening of the hair shaft. Paying special attention to the very ends of the hair, as this tends to be the oldest, most damaged parts of the hair. But Sandra actually looks like she's had a cut recently, as her ends are rather blunted. Okay. So checking one final test for integrity of the follicle. What I'm going to do is brief twisting here. So very gentle, okay? We're never pulling the hair. We're just a very light, taut motion. As soon as you see manipulation of the hair or of the skin along the hairline, that is more than enough pressure. And what you're looking for is any breakage with this manipulation. So when you pull down and apply pressure to the hairline, we're looking for any breakage, any shed hairs, any hair that is just pulling away at the follicle, which is not noticeable in Sandra's hair. Okay? All right. So, proceeding with our assessment, why don't we go ahead and perform some agitation of the areas. So, I've got these little silicone gripper tips here, and we are going to use these to very gently manipulate the skin. So we're just stretching, pulling away from each other, just like this. Just pulling away. Right at that hairline, we're just going to go back and forth. Outward motions. And then once you've completed that along the length of the hairline, you can then pull back into the hair itself. No notable dislodgement of any dead skin cells. I don't see any flaking. And again, not seeing any signs of infestation here in Sandra's hair thus far. For safe measure, we can also do that at the brows. Again, very gentle manipulation, specifically around the eyes. Okay, all right. So I am going to move into obtaining a few base measurements here. Okay, so nothing super specific, as Sandra is mostly here for an infestation assessment, but I do just want to show you what that would look like in practice. So we're going to go in with our ruler, or our tape measure, I should say. I like to start just at the lobule of the ear, so right at the earlobe, stopping right about centered with the nose. Sandra is right at about 6.5 inches, so we can then compare that to the other side. And that is about even there for Sandra, about 6.5 inches on this side as well. We can also measure from the arch of the brow to the point where her hairline starts, which is about 2.5 inches. Actually slightly shorter on this side, only about 2.25. So there is a mild variance there, which is normal. The only time it would be concerning is if you're seeing a really big difference from one side to the other. So for example, if one side was 1 inch and the other side was 3 inch, then we wouldn't be concerned so much about asymmetry, but we would be looking for a drooping of the facial features. Okay. So following that assessment for overall integrity of the skin surrounding the hairline, I'm going to go in with our small suction tool, and I like to use this to provide aerated pressure directly onto the scalp. And I find that if there are any signs of infestation, the sensation of the air kind of brings them to the surface and allows for easier visualization. So just squeezing at the pipette and then placing it on the skin and then releasing. You can also do that within the scalp itself. And again, just going in different areas, ensuring that you're testing throughout the scalp. That's a good question. So Emily wants to know what would happen if during this portion of the examination a louse or several lice were to come to the surface. What would you do? Now, in clinical practice, as I stated, your hair should be, wrapped up in a ponytail, in a high bun, and then some sort of hair protection on. Specifically, if you're testing your patient for lice, obviously there's always an unknown, but if that's what they came in for, then you would be wearing proper PPE. Would even suggest wearing a disposable gown. Now, if you were to see lice, then at that point that would be an obvious positive indicator and you could then begin treatment. So at this point, we are assuming that Sandra isn't sure if she has lice. Could be something else, could be contact dermatitis, could be seborrheic dermatitis, could be a bunch of other things. She could be having an allergic reaction. Her only symptom so far has been mild flaking and itchiness. So it doesn't necessarily mean that it's lice. We are simply performing an examination for the purposes of the demonstration. So just keep that in mind. In clinical practice, obviously you would be more cautious. You would test things a little bit differently. And once a positive indication is noted, you would document accordingly and you would begin treatment. Okay. So treatment typically looks like a topical solution. I usually, if my patient is, mobile and up ad lib or even up with assistance ×1, we can get them in the shower, do a medicated shampoo and condition, and then when they get out, apply a leave-in treatment. Sometimes takes a couple rounds before the lice is treated. If your patient is fairly independent, then you can just send them home with topicals that they could apply themselves. Okay. All right. So, just for good measure, I'm going to go in with our surgical sponge. I like to use this as an agitator. Slightly abrasive, but doesn't cause any discomfort to the patient. It just is very specific but soft enough bristles where it doesn't scratch the skin. So I find that this is a good tool for this examination or for scalp exams in general. We're just looking for any further signs of dislodgement. So I will oftentimes ask my clients or my patients to come in with unwashed hair. Sometimes freshly washed hair can be slightly deceiving. So because Sandra has washed her hair very recently, either this morning or sometime yesterday, it's fairly difficult to see if there would be any excess flaking that we would find of the hair. It's harder to analyze the sebum of the scalp or the oil production. So if you ask your patient to come in for a planned visit with hair that's 2 or 3 days old, not washed, it's just a little bit easier to assess for certain things. So just keep that in mind. If your appointments are scheduling ahead of time, I would make it a requirement that they come in with dirty hair. Okay? So overall, not seeing anything here for you, Sandra. You can also just look at the sponge and see if you notice anything here, which I do not. So another negative indication that Sandra does not have lice. Now, semi-unrelated to a lice examination, but for a scalp examination as a whole, I do like to percuss for sensitivity. So you would go in with a reflex hammer and provide a light percussion, always using your hand as a buffer on the patient's skin. We don't want to tap with this hammer specifically. I will show you a secondary smaller hammer where that is appropriate, but because this hammer is heavier, I like to use my hands to gently percuss along the scalp. And you would then ask the patient if there are any areas of tenderness, if any of this is causing discomfort, any pain, and then you could assess further. So let's say, for example, I percuss here, and Sandra tells me that that feels slightly painful or tender, then we can go in with some further testing and evaluate what could be going on. Okay? An example of the smaller hammer would be something like this, a double-sided. I like to use the smallest side, and you can go in and just tap very gently. And again, we would just ask our patient if there are any areas of tenderness. You can also use this to check for any signs of edema, any areas of excess fluid. So here, for example, is more bony along the forehead versus here at the cheek where you have that buccal fat pocket. Just a slightly different sensation, and those are things that you begin to notice within your practice. Okay? Now, if we were concerned about any neurological symptoms, or we were concerned that Sandra may be experiencing some sort of stroke, or she's had a recent seizure, or you notice twitching, or for whatever reason there's a suspicion that she could be having some sort of neurological defect, then we maybe would test for sensation. So briefly, just to show you, for demonstration purposes, we could use a tuning fork, produce a vibratory sensation, and then I would place it here at the crown and ask, Sandra, do you feel vibration here?
No.
No. And then if we do that again, do you feel anything there?
Yes.
Good. Testing for bone conduction. Do you feel vibration here?
Yes.
In here?
Yes.
Good. Secondary to that, we could go in with testing for cold response. So I have just an ice globe here. This has been kept in the freezer. So Sandra, if I touch this to your skin, I'd like you to just indicate whether or not you feel anything here, okay? So can you tell me if you feel this?
Yes.
In here?
Yes.
In here?
Yes.
In here?
Yes.
Here?
Yes.
Does that feel cold to you?
Yes.
In here, does that feel cold?
No.
Here, does that feel cold?
Yes.
In here?
No.
In here?
No.
In here?
Yes.
Good. Now it's slightly more difficult to check for cold response within the scalp because obviously the hair acts as a barrier. So you can attempt by creating a very distinct part within the hair itself. So I will try to demonstrate that here for you. So as you can see, I've created a part in the hairline here. Sandra, can you feel that this is cold?
Yes.
Does that feel the same coldness all the way across?
Yes.
Very good. Okay. And then lastly, for sensation, you would want to test for pain response or for sharp. So I have a Wartenberg wheel here, obviously very sharp. So we don't want to, put too much pressure or cause any abrasion or scratches or scrapes on the patient's scalp. So be very, very delicate here. Sandra, I'm going to touch this to the surface of your skin. I want you to tell me if you feel anything.
Yes.
And does that feel sharp?
Yes.
In here?
Yes.
In here?
Yes.
In here?
Yes.
Along your hairline, does that all feel the same sharpness?
Yes.
And would you say that this side feels the same to this side?
Yes.
Again, make sure you part directly in the hair so that you are actually touching the scalp. So once you can actually visualize the skin of the scalp, Sandra, can you feel that?
Yes.
Does that feel sharp?
Yes.
And here, does that feel sharp?
Yes.
Very good. All right. So sharp sensation is also intact. Okay. So that would complete your basic scalp inspection, focusing on infestation, any areas of concern of the scalp. You could also be testing for things like dermatitis, like we discussed, or psoriasis of the scalp, those kinds of things. Okay. So I would say that Sandra's examination today went very well because we didn't see any signs of infestation, but she did come in with a chief complaint of itchiness and, you know, flaking of the scalp. We'd probably be looking at something closer to a dandruff, in which case I would just prescribe or recommend an over-the-counter dandruff shampoo that she could try for a few weeks. I usually recommend to use at least 3 times a week for 2 weeks, at which point if we're not seeing any improvement, she can come back in for a reassessment and we might need to try something a little bit stronger. Okay? All right. Does anyone have any questions before we allow Sandra to leave for the day? No. Okay. So I want everyone to update their notes. As always, there will be a quiz. Okay? All right. Thank you. Thank you, Sandra. We appreciate your time as always.